In this video, you'll learn what everything in the lab is.
So right here, we're gonna go ahead and have additional surgical masks. Then we're gonna go ahead and have our gauzes. We have the woven gauzes, and we have the non-woven, which are the soft ones. We also have the small gauzes that are really good for pressure dressing. We have styrofoam cups for when Dr. Kormeili needs liquid nitrogen. We also have an extra numbing cream here, which is new. Then we have all of the instruments. So right here we have them all labeled by what each basket has, and it also has labels on the side. We have our surgical kits, so we have for face and for body. And then on this little basket, we have everything for the hair transplant. We also have some additional long gauzes here.
Those are used for the TCA peel.
Then we go ahead and on this cabinet, we're gonna have hair nets, hand sanitizers. We have needles, cannulas for the face and for the body. And then we're gonna go ahead and have our TCA peels here. We keep them separated from the glycolic, salicylic, and mandelic peels that we have. Here you'll find the rest of the peels. We have some additional honey gel in the bag that we use for the rooms. We have acetone, alcohol, triamcinolone. We also have additional catalog in the back. Arnica, silver mat that we use for the threads. We have our glass shots that we use for the chemical peels. Some painkillers, and we have the medicine cups that we use to give the patients the pills. Here we're gonna find things that we use in the daily, like the sodium bicarbonate, saline for the Sculptra, Kenalog, regular saline for Botox. Then we have the bupivacaine that we use for the PRP, lidocaine without epi, silocaine 1% that is used for the hair transplants, calcium chloride, regular saline that is TAC. Then we have more sodium bicarbonate, Kenalog, and silocaine, which is lidocaine with epi, and then just a regular saline.
So it's important to keep all the salines apart. The one that says TAC on it, it actually is not just saline, but it's actually triamcinolone, Kenalog. So it's a mixture of the saline in which we have put in one of the Kenalogs from the back. So that is drawn up and added to these little bags and labeled as such. The other ones we keep separate for Botox and Sculptra because we need to reconstitute those. They come in a powder form, and we want to make sure we never get other contaminants in there.
Right, then and lastly, we just have our Consultation that Dr. Kormeili would use for warts as well. On these last cabinet here, we're gonna go ahead and have normal saline. We have the small and the big bottles. It's usually used for the hair transplants as well. We have the space frames up on top. We have some ultrasound gel that we use for therapy, and we have additional lidocaine without epi right here as well. We have the bupivacaine, then we also have the silocaine, and we have saline right here as well.
So as we run out from this cabinet, we replenish from this cabinet, and we date it, and we put it into the other cabinet. So when this cabinet is running low, we need to order.
Then we